A common question that people have is what to expect at a first therapy session. You may have been in therapy before, but with a different therapist, wondering what's this new therapist going to be like? Or perhaps you've never been to therapy and wonder what is the process like? Before the first therapy session, you'll have filled out intake paperwork explaining why you want to come to therapy this time. What are the circumstances in your life? We'll ask about physical issues that could be impacting your emotional health. We'll be asking about the people in your life, um, what your identity is from whether you're a student or employed or a parent, who are the important people affecting you, and most importantly, what brings you to therapy at this time. So even though you'll have prepared that information through the background information, the first session, the therapist is going to want to review that information with you and hear in person um, what comes through when you tell them that story live in person. So, for example, you might mention that a relative has recently passed, but in person, that might be someone that, when you relay that story, has a little bit of a distance to it. It isn't an immediate concern or an immediate grief that you're processing. Whereas in contrast, when you start to tell the story of that loss, a lot of emotion might come forward. It might connect to other grief or other pain that you've had in your life. And that live experience of telling the therapist at the first session why you're there gives a lot of experiential information, not just to the therapist, but also to you in the telling of your own story. So we call the first session an intake for that reason, that we're intaking the information, we're trying to get a picture of what your needs are, and we're trying to figure out, is that therapist and you a match for the type of work you want to do? And sometimes that comes down to something as simple as temperament. Just like dating, you might meet someone that's got a wonderful personality and you respect them and like them, but there just isn't that right click or sense of safety. We know from research that the sense of trust and what we call therapeutic alliance is one of the key factors of outcomes long term in therapy. It's hard to tell sometimes at the first appointment. So we encourage you, unless something just feels terribly off at that first meeting, and if it does, do address it live. Tell the therapist about what feels odd, tell them what is happening that you're not expecting. Put your expectations out because you are a co-navigator and a co-creator of the therapeutic experience. Even though the therapist brings expertise and training in therapy and in how to treat some of the issues you might be there for, you ultimately are the expert on you. You know what matters. You know the language that fits your experience. You know that the edges that need to be explored and the ones you've already dealt with. So we really want to encourage you to be an active voice in the therapy process, but especially in the beginning as you're trying to figure out a roadmap together. So we encourage you to try 2 or 3 sessions with a therapist. The therapist should be asking you at every appointment, how does this feel? What's it like to talk to me? Are we addressing the things that matter to you? Because there might be, like a lot of us, a long list of stressors around us. And trying to figure out which of those are the important ones to focus on is really the task of the beginning of therapy, those intake appointments. So our next series of videos will be talking about how to build on the intake process, how to deepen the therapeutic alliance, and how to empower you as the client to try to speak to what you're hoping to get from the therapist and to try to empower you to be direct and clear about what feels good or doesn't each session. Um, People often ask, how many sessions will it take till I feel better, until something's resolved? A lot of that is one of those unfun, it depends answers. But I would say to expect that the first 2 or 3 sessions, you should be feeling at least more clarity in why you're there. You should be feeling a sense of a potential roadmap. What would it look like with this therapist to work on those issues? And that also might give you a sense of, how frequent coming in will help, just like any dosing in medicine. Taking certain things more frequently, you will see better results. But that doesn't mean you need to come to therapy every day. though often we find that starting off weekly, at least for the first 4 to 6 weeks, is what builds that foundation of a sense of trust. And it's from that trust that that alliance builds, that safety to open up, to talk about the deeper issues, that the harder edges of vulnerability become more possible. Um, from there, again, new issues might arise. So you might be with your therapist kind of slightly pivoting and changing where your focus is, keeping track of the arc, and really ideally each week looking at what's also not just happening during the therapy session, but between the therapy sessions. Because our goal is to be teaching you the awareness, the skills, the empowerment to take the things that you're happening in the therapy session, almost like a safe experiment or you know, like a little bit of a sand tray, like a playground, into real life. So practicing conversations, making sense of something that was confusing, but then going back into your life between sessions that you get to then approach it with a new confidence and clarity and awareness. I hope this helps as far as what to expect at your first few sessions, that you're going to be reviewing the intake information. There's some bureaucratic things we have to cover legally about confidentiality, if you're using insurance, how a diagnosis or how the insurance plays into us, how we document your care and how your care gets covered. And then from there, a lot of it's the creativity of you and that therapist. There's different modalities of therapy, some more directive, some more client-led. And so in our next video series, we can talk about how to maybe find the type of therapy that matches the issues that you're looking for. Um, if you're looking for a therapist, one of the things we're proud of at Puget Sound Psychotherapy and Psychiatry is our amazing team that helps to do custom matching rather than you just randomly picking someone from a website, though you can look at our site and read profiles. You'll be talking to our team that knows our therapist. They have training and really listening to what style, both of therapy and also of your temperament, would be a good match. So we're really proud of our success rate in having those first appointments lead to long-lasting, good therapeutic change. Our information's below. Reach out via phone, email, our form. You can even text us. We try to make ourselves really accessible. We know the first step is sometimes the hardest is to reach out for support. We look forward to hearing from you and from supporting you.